Welcome to the press conference. Mr. Edward Yau, Secretary, will give some opening remarks, and then the floor will be open for questions. Mr. Yau, friends of the media, good afternoon. On the 8th of September, when I met with the media, I mentioned that Hong Kong was in the process of negotiating air travel bubbles with different countries around the world, and we've made some progress. So I'd like to take this opportunity to report our progress to you. Yesterday, we reached an in-principle agreement with Singapore. Between Hong Kong and Singapore, we're going to establish a bilateral air travel bubble ATB arrangement, which will allow Hong Kong and Singaporean travelers to resume traveling as long as the 5 major conditions are met. First, under the ATB, travelers will be required to take the mutually recognized COVID-19 PCR test and will need to have negative results. Second, travelers will not be subject to any restrictions on travel purpose. Be it for business, for sightseeing, there will not be any restriction. Third condition, travelers under the ATB will be required to travel on dedicated flights. In other words, these flights will only serve ATB travelers, and no transit passengers or non-ATB travelers will be allowed. The fourth condition is that travelers will not be subject to any mandatory quarantine or stay-home notice requirements. Whilst in either city, the travelers will not be subject to a controlled itinerary. Finally, this arrangement can be scaled by adjusting the number of dedicated flights or even suspended in line with the latest development of the COVID situation in 2 cities. In face of the pandemic, the arrangement will allow a safe environment for travelers. Under a controlled arrangement, we can facilitate traveling arrangements, and this will also be an important milestone arrangement for both cities. Having reached this bilateral agreement in principle, we've set up a bilateral mechanism on mutually recognizing the COVID PCR tests and the test results, as well as flight arrangements. These details will be ironed out in the coming few weeks as we press ahead so that air travel bubble between Hong Kong and Singapore can be established for travelers to go between both cities. Meanwhile, in Hong Kong, we'll work with the Department of Health and the Airport Authority of Hong Kong, as well as flight carriers, to put the mechanism in place. So this will be a very important starting point. And under this important framework, we'll continue to negotiate with countries on bilateral travel bubble arrangements so that more travel bubbles can be established. As I mentioned previously, we have been discussing with a number of countries. Now, Singapore is the first country that set up this travel bubble with us. And under this arrangement, we can ensure that whilst the epidemic situation is under control, we can facilitate travel between both cities. In other words, we keep traveling safe and we try to lift unnecessary restrictions so that when the epidemic eases, we can resume traveling and allow gradual resumption of normalcy in society. I'll be happy to take questions from members. Please introduce the organization you're representing before you ask a question. On the right-hand side, this gentleman in blue. I'm from Metro Radio, Secretary. A question on Singapore. You said in the coming few weeks, you'll seal the deal with Singapore. how soon do you think the air travel bubble will be set up? And about travelers coming from Singapore or Hong Kong travelers going to Singapore, will there be any controlled itinerary, and what will be the validity period of travel? And what about other popular tourist destinations such as Japan, Taiwan, etc.? What is the progress now? What are the obstacles or hurdles, and how would you address the concerns so that the agreements can be reached? This morning, the Alliance of Travel Agents held a press conference. Under the group gathering ban of 4, it is impossible to organize a tour under the epidemic. So is there any room to relax the ban? Well, let me answer the questions relating to air travel bubble. Starting from June, we have been approaching 11 countries around the world to start negotiating on air travel bubble arrangements. But of course, this would be a bilateral agreement, and consideration will also have to be given to the development of the COVID situation in these places. As I mentioned in the last press conference, it's not done on a first-come, first-served basis. We have to give regard to the COVID situation and also other situation in those places. As for the ATB with Singapore, under the framework I just introduced, we have reached an in-principle agreement to establish the ATB, and then we'll iron out the details. On our side, we will need to amend the legislation to ensure that there will be legal safeguards under this arrangement. Bilaterally, as I mentioned just now, the PCR test will have to be mutually recognized by both places. So for the laboratories and testing organizations in Hong Kong, we will provide such a list to Singapore, and there will also be a reciprocal list from Singapore for mutual recognition. The other part is to liaise with flight carriers and the airport authority, and we will work on these areas in the coming few weeks. And once these are done, we can then resume traveling between 2 places. You mentioned other restrictions, for example, itinerary. Under the ATB agreement reached, whilst travelers are within the city, they will not be subject to any control of the itinerary, because once they test negative, they will not be subject to any such requirement or restriction. As for other countries, will continue to work full steam. There may be different requirements coming from different places. We must bear in mind, well, in fact, in June or in July, when there was a rebound in Hong Kong's epidemic situation, our work was delayed. Likewise, when we negotiate with another country with a spike in the number of cases, we may need to rethink. We'll work with the healthcare authorities, and the authority will provide us advice on whether we should go ahead with the negotiation or impose other conditions. So in Singapore's case, once the conditions are ripe, we can then proceed with this arrangement. I will first answer other questions relating to travel bubble.
I'm Wong from Apple Daily. 3 questions for you, Secretary. First of all, if I may understand the following. Like the mainlanders or people from other countries, if they come via Singapore, will they be included or covered by such a mechanism, and vice versa for Singaporeans? And the second question is, just now you said that for the framework with the various features, you're saying that it may become a model for other countries. In other words, does it mean that Hong Kongers will be subject to a test and will be getting a negative test result before they can go to other countries? And the third question is, have you ever talked to Taiwan in relation to the resumption of traveling? Well, for the air travel bubble, for travelers under the scheme, they need to undergo a health test. And then we have to make sure that Say, for example, they haven't been to any other places 14 days prior to the travel. In other words, if somebody would like to make use of the scheme without undergoing the test or having been elsewhere within the 14-day period, then they will not be acceptable. So we do not allow others to come to our places indirectly. Well, we have talked about dedicated flights, and we do not accept transit passengers on board. So that's a feature of the scheme. And secondly, on the face of it, it may sound simple, but then you need to understand that we would like to strike a balance between two principles. First of all, we want to make sure that we are still able to control the spread of the infection. So we have to depend on the tests. In other words, the tests would be the prerequisite. Anybody going on board must have a negative test result of a test that is mutually recognized in relation to COVID-19. And then we have to make sure that in the process, say, for example, arriving the host city, there will be a test upon arrival, either in Hong Kong or Singapore. We believe that in the foreseeable future, such tests will be necessary. And recently, we have been stepping up our testing capacity gradually. And lately, there was the Universal Community Testing Program, and we have enhanced our testing capacity. If I remember correctly, 17 testing centers are capable of providing such tests. So this is what we call the new normal. For Taiwan, it is not on the list of 11 places that we have been having discussion. Good afternoon. I'm from cable TV. You talked about being out with a negative test result before you can go to Singapore. Is there a time limit? And then before we come back from Singapore, we have to get tested as well. Is it easy for them or for our Hong Kongers to get a test in Singapore? How many testing centers there are? And what about the airliners involved? And then what about the discussion with the other countries? You said there were 11 of them, like Japan and Thailand, etc. What are the difficulties? Which ones are going to bear fruits? What's the first question? You talked about negative test result. How many days prior to the travel? Are there many testing centers in Singapore? Is it easy to get tested? Well, such are the details that we have yet to confirm with Singapore, and we leave it to the health authorities. Generally speaking, we draw a line at 72 hours. That's what we have been doing in Hong Kong. That is, before you go on board, you need to have a negative test result. For Singapore, we know that they have got testing centers. They have got testing centers at the airport. They have got testing centers downtown. In Hong Kong, we have seen an enhancement. You are aware of the hospital authorities' testing capability and our universal community testing program. There are also 17 recognized laboratories or hospitals that are capable of providing such tests. So we are quite well placed for the flights. Of course, we would like to be cautious and progressive, and we will be relying on the existing flights, and we leave it in the hands of the Transport and Housing Bureau as well as the airliners. We have started discussion with different places, and the progress varies for each and every sort of place. In the light of their own circumstances, they have got different requirements. In some cases, they would like to start with travelers with specific travel purposes, say, for example, business travelers. For other places, they may want to impose some strict requirements, like travelers have to stay at a certain place or they can't take public transport. In the case of Hong Kong, our requirements are similar to those made by Singapore. On the one hand, we want to have safeguards in place. On the other hand, we understand that for us to resume normal operations, we don't want to impose too much restriction. Otherwise, it will be a far way away from normalcy. So we want to strike a balance. So we want to have safeguards in terms of public health. And then both Hong Kong and Singapore are such that we are a small place, and as long as we can protect the health of the travelers, we believe that we can go ahead. The lady on this side in the third row.
Can we do the travel bubble implement it during November or December this year? And do we have to wait for the border between Hong Kong and mainland to open first before we get that travel bubble to officially launch? And my second question is, what happens if, touch wood, there are imported cases from SG to Hong Kong? What are the protocols to be put in place? Will we have a break or suspension for the travel bubbles? And my third question is, with the travel bubbles starting to be announced, is it fair to expect that Hong Kong will keep all the border closed, all but 3 of the borders closed unless they are residents, or in travel bubbles until a vaccine is proven to work or throughout next year? Thank you.
Yeah, I see. The first question, I think we are doing this initially on a bilateral basis. We have being approached altogether by 11 countries to start a bilateral sort of arrangement to revive traveling. And in the process, Singapore and Hong Kong are among the first partners that are able to lock in this mutually agreeable arrangement, whereby fulfilling certain conditions, essentially sort of a mutually recognized COVID-19 test, bubble flight, ensuring no transit passenger coming in, and also sort of imposing these conditions to allow travelers to come or go under this arrangement. Now, we have to proceed this on a bilateral basis. Whenever there is a mutual sort of agreement between Hong Kong and our partners, we'll proceed along with that. So there is no any magic on the sequencing, because different countries might have different consideration of their own. And also the epidemic situation also varies. We ourselves in July had suffered a community outbreak, and therefore it has put back some of the discussion. So we will be moving along this line. Whenever situation allow, whenever the conditions being mutually agreed, then we will proceed on that basis. Your second question about what if circumstances turn worse? Of course, as I mentioned, in one of the 5 conditions, these arrangements could be adjusted, could be relaxed if situation improves, or could be sort of reduced in order to sort of minimize the risk, or suspend in the circumstances we don't feel comfortable. So there are mechanisms to handle those, and it will be mutually guided by our sort of public health experts as well. As to your last question, I think nobody throughout the world can say for certain when everything can resume normal. Somebody said, well, when vaccine comes out, we'll see light at the end of the tunnel. But to what extent the vaccine will be sort of widely applied to create, to allow us to have that sense of comfort, I think nobody can have a crystal ball on the timing. So in the meantime, that's why it's important for us to sort of move at the same time various ways to revive normal traveling as much as possible, provided we can put the virus under check. So the set of conditions that has been agreed between Hong Kong and Singapore could be a milestone where we both feel that, well, by fulfilling these conditions, we would be able to put the virus under check through this sort of test and also arrangement. But at the same time, we should make it as facilitating as possible so that, well, travelers can resume some level of traveling without too much hustle. So I think this is a compromise. It's a balancing act between these two constraints.
Next question, right-hand side. This journalist in white. I'm from Hong Kong 01. Good afternoon. First of all, why isn't Taiwan included in the 11 countries you mentioned? Because in Taiwan, the epidemic situation is under control. There are tests available, so the two important conditions can at least be met. Why hasn't there been any discussion with Taiwan? Is there any political consideration? Second, at the airport, will there be any test stations for COVID tests to be carried out before Hong Kong travelers come back to Hong Kong, and will they have to wait for a while before boarding the flight? And will this be done in other cities as well? And what about the costs or fees involved? Will there be any mutually recognized organizations on the part of the government for carrying out tests? Third point, has there been any liaison or discussion with travel agents in both cities? And if we receive Singapore travelers in Hong Kong, will there be a concern on the gathering ban of such that they cannot form a tour of more than 4? When we start discussions with any place, first of all, either place may initiate such a discussion as long as both sides are interested, and this is the basis on which we carry out our discussion. On tests, when travelers arrive at the destination, the port authority will carry out tests. As per the arrangement with Singapore, I believe tests will have to be carried out upon arrival. I know that the Food and Health Bureau, Department of Health, and the Airport Authority are discussing the arrangement on expediting tests on arrival to facilitate travelers. This will also facilitate a further establishment of air travel bubbles. Because under the ATB, tests will have to be carried out before a traveler boards the flight. In Hong Kong, I understand that tests are provided upon arrival. At the same time, I understand that there are more and more testing agencies available in Hong Kong, including hospitals, clinics, and also laboratories recognized by the Hong Kong government. So locals may approach these organizations for tests. When we discuss with Singapore, we understand that they have similar facilities and testing services at the airport as well as within the city. As for fees, that really depends on demand and the market mechanism. In Hong Kong, with the increase in testing capacity and increase in the number of laboratories available, we see fees coming down. We believe Singapore to be experiencing the same, but of course, travelers will have to bear the cost of tests. Your final question. Well, I think our first step will have to be more stringent, and we take a small step, and then we will gradually relax the requirements. Perhaps the first batch of travelers may come for business, not for sightseeing. And travelers will also make their own judgment on the epidemic situation in another place. But once we establish the first ATB, it gives a good outlook. If Hong Kong is able to establish more and more such travel bubbles, then there'll be a higher chance for the travel agents and the tourism industry as a whole to be lifted out of the plight. We hope to be helpful for the industry. Well, we can answer 2 more questions on travel bubbles, and then Secretary will answer the previous question on local tours.
Mr. Yau, can you say at this moment when is the earliest possible date for this travel bubble to kick in? My first question. Secondly, would it at all be depending on the virus situation? Like, say, if the epidemic at both places remain the same, or if it spikes up, would it be too much of a hassle for you to suspend for a week and then bring it back on? Like, how sensitive would the arrangement be to the epidemic situation? Those are my two questions. Thank you.
The first question, I think it is an important milestone today that we have reached an agreement with the Singapore side to proceed on this framework. The remaining work is to finalize all the details with a view to allowing people to travel through this bubble arrangement as soon as possible. I mentioned in the press release that we hope to use the coming few weeks to put in place all these requirements, which involve certain legislative amendments, arrangement with airport and also airlines, and also the sort of mutual recognition of testing protocol, etc. So we hope that all these could be done within the coming few weeks, and if we are able to sort of finish it earlier, then of course traveling can be resumed much earlier. Your second question, of course, in establishing the air bubble, it must be premised on safe and low risk, and also the common objective of the virus able to be contained through all these sort of control measures. So this is a prerequisite, and that's why among the 5 criteria, we put in certain requirement on that. And it is also premised on a situation where both sides feel comfortable with the epidemic situation, particularly its containment on the other side. So these are all factors that we are considering and will also be kept under review. That's why we have also agreed on an arrangement that, this bubbled sort of arrangement could be adjusted in the light of situation. It could be further relaxed if both sides feel more comfortable or seeing an obvious improvement in the containment of the virus. But if circumstances somehow unable to allow us to do so, then there would be mechanism for us to adjust it, to reduce it, or if really need be, a temporary suspension. So these are mechanisms that will based on science, based on situation, and in fact also sort of taking on this very important balancing act between containment and also facilitation.
右邊最後嗰行紅色衫嗰位男士。
This gentleman in blue. Good afternoon, Commercial Radio. First question, Secretary. So there is no definite date when this will be implemented, as you put it, but in Hong Kong, the epidemic situation is still rampant with untraceable cases every day. So if untraceable cases continue to emerge on the day when the ATB comes into operation, then will you continue to commission the ATB? Or have you laid down certain criteria? Say, when so-and-so happens, you will then put the ATB to a halt. Can you tell us these criteria? Second question, I didn't catch it quite clearly just now. Say, when somebody decides to travel to Singapore or vice versa, how many tests will one undertake? Where will the tests be carried out? Will the traveler bear his own costs, or will there be any subsidy from the government?
Let me take the second question first. Under the bilateral agreement, first of all, what is most important is the mutually recognized test. And the prerequisite is to get a test result within 72 hours of getting on board. So it will be a mutually recognized COVID-19 PCR test, and the test result must be negative. armed with such a test result, the traveler may get an air ticket from the airliner and then proceed with the traveling arrangements as usual. And then, upon arrival, the health authorities would reserve the right to press for another test. As you know, when travelers come to Hong Kong, we need a test to be undergone by the travelers. So, depending on the test result, then the traveler can come in and out freely. We won't check the travel purpose, and we are not going to impose other requirements like quarantine arrangements or any other mandatory requirements, because basically the requirements have been met. So that's about going out and outbound traveler. He has to undergo such requirements, and the cost will be borne by the traveler. We'll be talking to the airliners to try to simplify the mechanism. Say, for example, whether it should be incorporated into the price of the air ticket. So we try to streamline the arrangements to facilitate the travelers. That's my reply to your second question. I've forgotten your first question. What are the criteria triggering the launching of the air travel bubble? Does it mean that we need to have zero infection before we can have it? It was on the 8th of September we started the discussion with Singapore. We have examined the situation. The health officials on both sides have taken into account the control of the infection as well as other matters in relation to public health. So the health officials will decide on the criteria to adjust the scale of the ATB. I'm sure they will take into account the current situation, like the number of cases and whether there is a community outbreak. We'll look at the control measures, we'll look at the public health capacity, the hospital capacity, etc. I'm sure both cities will ask their health officials to look at the matter. Well, for the final question, that's about the local tours as well as the local travel industry. Yes, for our local travel agents, they're saying that with the gathering ban of no more than 4, it is impossible for them to arrange local tours. And then we have the third phase of the employment support scheme. We understand that 80% of the travel agents are saying that it is very likely that they have to lay off staff. Well, for tourism, catering, and other sectors, they have been suffering a lot in the pandemic. Of course, they would like to have all the restrictions eased, but then there is a consensus in the community. Before we can control the infection, we have to strike a balance. For the gathering ban, whether it is 2, 4, or whatever, we have to take into account the actual circumstances. But still, I think different sectors can adopt different measures. Like the catering industry, the industry has adopted extra caution measures. Likewise, the tourism industry can resort to additional measures. And in fact, the Hong Kong Tourism Board, as well as other organizations, have come up with some guidelines for the relevant industry, like temperature screening, disinfection, proper handling of refuse, etc. I think for such guidelines, it means that we're able to step up our infection control efforts. On the other hand, we're boosting the confidence of the consumers, and we are also providing more safeguards for the employees. Now, in the short term, we are not able to have a breakthrough, but still, if we have more control measures, then in fact, the entire industry can move forward. And the government is happy to talk to the relevant industry. We are happy to talk to the tourism industry to see what more can be done. Now, we know that we are not going to see a large number of inbound travelers in the short term. Maybe they want to turn their eyes to the local tours. Other than the gathering ban, maybe we can try to see what additional measures can be introduced to make sure that the tour members as well as the tour guides will be given extra safeguards. Then I think we can try to see what can be done to facilitate their operation. I think in the long term, I don't think we can count on government support to make sure that all the sectors and industries can survive the pandemic. Rather, I think we need to rely on collaboration while we try to strike a balance. For the tourism industry, I'm sure it has been hardest hit among the different sectors. But again, I have to say that it has been given the greatest support by the government. We have reserved $1.76 billion for the tourism industry. We have been responding to their requests. And then for travel agents as well as the employees, they have been given assistance by the government. And before we see inbound travelers, we try to see if they can have other sort of arrangements. So I think these are the various options that we can count on. And we're happy to talk to them about the solutions, and we can try to see if we can do more. That's it for today's press conference. Thank you.